Okay.
Welcome, everyone. Thank you for joining our webinar today. Our webinar today is going to be about how we are preserving mental health in the business of care. And with me are two doctors who each has an amazing career, and also they have a lot of care about this topic. So we're really grateful that they're joining us. My name is Carolyn Bao. I work for Edge as the head of marketing, and it's really my privilege to introduce our two speakers today. Dr. Saluja is a board-certified family medicine physician with expertise in managing chronic conditions such as, and a very strong focus on preventative care. He also holds a certification in hospice and palliative care and a certified medical doctor. Dr. Saluja has a lot more credentials, and I'll defer it to him to probably inform you in a second. I also want to introduce Dr. Melati. She is an endocrinologist who is based in Washington State. And she has a focus on individualized, compassionate care delivered both in person and through telehealth. She has founded the Seattle Endocrine in 2023 and has been recognized as a Seattle Met Doctor annually since 2019. And there are a lot more credentials as well of Dr. Maladi, but I'll defer it to you guys later on as we further discuss your journey to start your practice, your journey to manage all the practices. And as a non-medical professional, I apologize ahead of time for not pronouncing many of the terms that would be as great as you guys would. Without further ado, I'd love to kind of shift the gear to you guys. Besides what I had just introduced about you, would you want to just kick it off with maybe a few brief words for why you're here? Why is this topic interesting for you?
Yeah, I can start off if that's okay. My name's Daljit Saluja, primary care physician. Been practicing for over 20 years now, actually 23. Started as a solo provider back in 2002. And since then, we've grown to 14 physicians and we have multiple subspecialties as well. Dr. Malati, you may be interested to know I'm married to an endocrinologist. So we have something in common. You know, as I train residents through MedStar, I do what's called their continuity clinic through my practice. Um, all these young doctors come in and they're bright-eyed and they're eager and they're interested and they're motivated. And what I've seen is as we've gone on in time, a lot of doctors start losing that zest and that passion that they started off with. I think most medical students and most residents are so passionate. And I feel like a lot of us lose that over time. And I think a long time ago, probably 10, 15 years ago, I tried to find ways that I can maintain my interest and my zest and my passion for medicine and love for my patients. And I think that's what kind of drew me to this conversation today is to share what I've done and for to help people find their passion again in medicine.
Thank you, Dr. Saluja. And Dr. Maladi, how about your story?
So I want to first appreciate the fact that there's an opportunity to talk about mental health for us, mental and physical health. I feel like that is the part that we as physicians feel unseen. A lot of times feel, we are treated sometimes as machines who never need energy, and so that's very important. My kind of like work and how I got here is I finished fellowship in 2017. I joined a multi-specialty group private practice, very large, very well run. I feel like the first 2 years, in addition to learning how to be an actual physician in practice rather than in training, which is very different, I also kind of learned how a well-oiled machine works in terms of medical practice, what works, what doesn't work, how to get things going. And then throughout my career, kind of things changed, unfortunately, with that practice. And I hit the point of dragging my feet. As Dr. Saluja pointed out, young physicians come out and they lose the passion. I felt that I really want to do better. This is not okay. I used to be able to spend so much time with my patients, do whatever I felt is best, to the point of when can I retire? I literally, for over a year, I did the math of when can I retire? And I'm still quite young. I started practicing in 2017, and I'm hoping to practice for a long time. And I felt there's something wrong here. I felt this is really burnout, and this is not sustainable. This is not good for me, but this is also not good medicine that I'm providing. This is not a good care model. And so ultimately, I decided to take the leap of faith and go and start my own practice, which is what I did just about 2 years ago. So June 1st, 2023, we're coming up in a few days, 2 years. I knew nothing about how to run a medical practice, as I'm sure Dr. Saluja didn't know 20 something years ago, but I figured that, if people without any background in medicine can come and run a medical practice that we're all working in, I pretty much can learn and go on the go. And I feel it was a very good decision because it gave me all the passion that I was looking for. It gave me the ability to spend the time I need to look up things, to make decisions that are best for myself, for my patients, and for the team that I work with. And I felt I went from that kind of point of complete burnout, when can I retire, to thinking about, well, this is amazing and this is great, and I hope I'm healthy enough to just be able to do this forever.
That's such an amazing transformation story.
Thank you.
Yeah, you both mentioned, oh, go ahead, sorry.
No, I hope to share it with everyone and help people to kind of have that transition to a healthier point for themselves.
Right. And I want to quickly shift gear back to Dr. Saluja. You came from a solo practitioner, right, to later joining, and now you're the chief for the medical center over at the University of Maryland. It's a family medicine, right, at the University of Maryland Midtown campus.
Yes.
Reflecting on your journey, going from solo to leading a larger org, do you feel like the stress level increased, or like maybe it's parallel? How's your journey how has
Uh,
your journey been?
yeah. So just for clarification, I'm still the medical director of my practice, Saluja
Hmm.
Medical Associates. I have an admin role at University of Maryland as a chief of family medicine. I will tell you though, I interact with employed physicians all the time from big university programs, from Hopkins, from university, and they all have just as much stress and just as much burnout, if you will, as everybody else. I will tell you the difference though, and Dr. Maladia, I'm sure, can appreciate this, is that when you have your own practice or you're working with a group of your peers, you have a voice and you're heard. And your challenges are the same as your colleagues' challenges. I think it's much more stressful, in my opinion, to work for a big, large professional outfit like a Hopkins or a university, because your employers and the people making decisions and managing your schedule and managing the number of patients you have to see are not physicians, are not your colleagues. They are administrators. They don't have an understanding of what we do. And the beauty about what I do, or what Dr. Maladi does, is that we realize that what is the best, and Dr. Maladi said it beautifully, what is the best balance for me and my patient? Our patients always come first, right? And we're right there with them. Whereas when you work for a big organization where there are, CEOs and CFOs and COOs and all these OOOs, the honest truth is that they don't understand what we do for a living, and they think that we're dispensable as physicians, and our stress isn't real stress, and they don't value what we do. And I think it's a shame that there are not more people that are brave like Dr. Maladi anymore to sit and take that leap of faith, as she said, and say, you know what? I'm not going to be part of a system. I'm not going to be part of this huge group where I'm one of many. I want to make an impact. I want to do what's right for me, for my family, for my patients, and for my community. And I think that's what she's trying to do. That's what I've tried to do over the last 23 years.
These are really interesting points. I would love to delve a bit further into working with administrative staff and generally working through the administrative requirements as a doctor. Would you mind maybe just contextualize a bit more about what type of administrative tasks that are on your mind but they're almost contributing to the stress that you have to manage.
I'm happy to take that, Dr. Malati, if you'd like. So again, we are 15 providers. We have 2 more physicians that are joining us in the fall. We have multi-specialty. We have about 32 staff, non-physician staff. We do a little bit of everything. So when you talk about what is the role of our staff, it goes to answering phones, checking our secure texting app, checking emails on our portal, verifying insurances, checking patients in, doing their vital signs, doing procedures like EKG, spirometry, CGM downloads, all those kind of things, and then checking them out, giving them a new appointment. So there's a lot of moving parts in a private practice, in any practice. And how do you keep all those parts moving? I think it's easier for me to work with and manage my physician colleagues than it is to managing staff. And because physicians, this is what we want to do. This is again what we've studied 11 years, college, med school, and then our residencies, and maybe longer. Dr. Malati went and did a 2-year residency at fellowship after I was done my residency. And so this is it for us. We don't have options. We don't want options. This is what we want to do. Whereas your staff, majority of them, they don't mind the turnover. They don't mind going to the next venue or changing their careers or reinventing themselves. We can't reinvent ourselves. So I think the commitment for a lot of staff that we get isn't as much as a physician's commitment is to the practice. And that becomes a little bit frustrating.
And I think also in terms of staff, they learn something, and a lot of times they have growth opportunity, which is great, and we support them and we want them to grow in those roles. But then that creates the fact that we have a turnover. So we have new people coming in and we need them to learn the new skills and go on. And so for us, as Dr. Saluja mentioned, we're in that same role, but we're working with new people all the time in different roles.
And I think, and God bless her, I think, as you get more established and as you in a private practice and as you've been doing it longer, I think knowing how to hire the right person is also a learning skill. You have to remember, Carolyn, we as physicians, we're not taught business.
Nothing.
We're not taught how to hire and fire people. We're not taught HR. We were not taught, even about contract negotiations. We were taught none of these things. And we all learn by trial and error. And hopefully we don't make the same error multiple times in a row and we learn from our mistakes, but it is stressful. The one thing I've realized over time is that maybe not, initially I thought everyone who worked for me has to be in my viewpoint, in my eyesight. I have to see what they're doing. And now, when you look at things like, EMRs, and you look at things like Zoom, and you look at things like HIPAA compliant texting app, you really don't have to have everyone right in front of you. We don't even need patients right in front of us anymore with telehealth. So we really don't need all our staff in front of us. So now what that does is that opens up our ability to hire people who are the best qualified person and not just people who happen to be within a 5 or 10 mile radius of our office.
And I think also that's an important matter, frankly, because as small or large, it doesn't matter, because even the largest academic centers, they still get a big portion of their money from CMS and insurance companies. And as the payments have gone down and we're operating on smaller and smaller and smaller budgets, but we still need to pay all our staff and everybody, that becomes an important matter of how much you're paying, whom you're paying in your office, and the cost of having all the, extra office space and everything becomes an issue. So kind of being able to use those extra resources becomes more and more important.
Dr. Malati, if I can say it in a different way, it's about efficiency. We need efficiency in our practices because Dr. Malati's right. We're the only industry that I know of that our reimbursements are going like this and our costs are going like this. And so you have to be efficient or you won't survive.
Wow, this is so interesting because 2022, the MGMA poll did find 58% of medical practices have reported that staffing is a primary challenge, which surpassed the concern about expenses. But if I play back what I heard from you both is, while staffing continue to be an issue, cost is also inching up as a primary source of concern.
Absolutely. They go hand in hand.
Yeah,
Staffing and cost. Absolutely. Absolutely.
so true. However, I think we have some good stories about if the staff came in with good quality, they do save time for you. In the light of mental stress and the lack of time to practice self-care, I'd love to invite you guys to tell us about the math that I think I've heard from you. If someone can help save you 30 minutes per day, it becomes an amazing time saver. What are type of tasks that you were able to give to your remote administrative staff?
I
And how
think it's
did that
probably
help
very
you?
different for the two of us because I'm a solo practitioner and Dr. Saluja has a big practice. So for myself, pretty much everything is done through remote staff. I don't have anyone in person. I'm frankly in office only 1 day a week, but that 1 day a week I do everything myself. It's not a big deal. Frankly, in my previous role, when I was so burnt out, I went from having a full-time scheduler, full-time medical assistant to myself to having someone, sometimes nobody, and I got to the point of changing the bed sheet and stuff. So I felt like, well, if I can do this and I'm paying an overhead, I could do it myself, which is kind of how I'm here. But for everything for everybody on my staff is remote. I have 1.5 person, and everything from all the tasks that Dr. Saluja mentioned is done remote. So I have 1 person dedicated to all the phone calls, all the scheduling, all the kind of like everything that a check-in and check-out person in office would do, from insurance eligibility check to updating insurances, everything. And then my second person, who is I share her with a different physician. We do 50-50 split. We have trained her to be our medical assistant, but again, she's super efficient and we have her as a remote person. She does all the lab orders for future appointments. We usually put in lab orders for follow-up appointments 2-3 weeks ahead, calling the people and patients and letting them know that the labs have been ordered, doing all our prior authorization, insurance reaching out for whatever reason. If we need a phone call to insurance companies, we have her do all the more of medical stuff. I do less and less of all the admin work personally. I just oversee, make sure things are happening, double check once in a while. I just take a look and see if there's anything pending. When did it happen? I also check in with them to make sure the flow of things go well with them, but I really kind of like just oversee and make small changes in admin tasks. They do all of it for me.
And Dr. Saluja, how about your side?
Yes.
Yeah, I think you had mentioned about you were able to train your staff to start reading the radiology reports and then
So
compile.
yeah, so we've really pushed the envelope on how we use our staff. So I started with two virtual medical assistants about 8 to 10 months ago, and I thought they were phenomenal. Initially, their main jobs were answering phones, scheduling patients, calling missed calls. If patients left messages on our voicemail, using our HIPAA compliant texting app to contact patients, and eventually I tried to give them other tasks to do. So now we have 7 of them that we use full time, and they're phenomenal. And it's nice because the ones that I call my fabulous two, they're my originals. They're now the trainers of the new ones that come in, which has been very helpful. So I don't have to retrain people all over again. I just say, hey, you guys spend a week with this person, get them on board. Let me know what task you think we should give them, and we start giving them tasks to do. Our tasks have grown tremendously over time. So now there are a couple of things they do. I'm part of an ACO, which is called an Accountable Care Organization. One big thing about an accountable care organization is that if you have patients that go to the emergency room of the hospital, as a primary care doctor, you need to have them for an appointment within 14 days of going to that facility. So now they're able to get on my app and get a list every day of who are my patients that went to the ER in the hospital, and they call them every single day until they finally agree to come in and get seen, which is, I think, great. They actually review my labs for me. And if in my, I have my EMR identifies normal and abnormal labs with a different color. It's called the ECW is my EMR. And so basically, what they do is if they're normal labs, and I've trained them what I know are normal and not normal, because sometimes they call things normal that are not. But I've trained them, and now they'll come and send messages or call my patient, say, "Hey, Dr. Saluja reviewed your labs; they were completely normal. We'll see you at your next appointment." If they're abnormal, they'll review it with me. So we have a call. So when I'm driving to work in the morning or driving home in the evening, they'll call me and say, "These are the labs of these patients that were abnormal. What would you like to do?" So I tell them, they document in the EMR, and then they call the patient telling them what I want to do. Again, saves me time. Same way you were talking about radiology, same way. So whenever we get e-faxed our radiology reports through the portal, they'll go through them. If it's absolutely normal, they call the patient, let them know, and they close it out. If it's abnormal, enlarged thyroid, or they have thyroid nodule, they'll call me. I'll tell them what to do. I'll tell them who to refer to for an FNA, and they'll take care of the referral and call the patient.
That's
So
amazing.
two administrative tasks right away that they take care of for us, which I think is very, very helpful.
Amazing.
But I think it takes time. You have to train your staff well. And again, the staff that I use are highly educated. They're physicians in their country. They're very smart. And I make sure that if you're not sure about anything, let me know. I spot check everything they do. I do quality control with them, but it's still much easier to do quality control than to sit and have to answer each and every normal lab that comes through.
Right.
So
This is amazing.
they probably saved us probably between 30 and 45 minutes a day, which make my doctors very happy. So going back to burnout, now my physicians who are done seeing patients at 4:30 are actually leaving at 4:30 as opposed to leaving at 5:30 or 6 o'clock. And each physician, so out of my practice, every VMA has two physicians assigned to them. They only work
Mm,
for those. So they answer phones for everybody, but those specific tasks, labs. So each doctor gets to say, "This is how Dr. Saluja may do it this way. This is how I want you to do it for me." Because every doctor deserves to have things done the way they feel is best for themselves and their patient. Just because I do it one way and I've been in the practice the longest doesn't mean I'm doing it the right way, the most effective and efficient way for them.
that's amazing. What have you seen the doctors do differently now? Do they report that they're doing more personal workout time or
Yeah,
developing
so
new hobbies?
yeah, so I think my docs are going home and it's still daylight out, so they're going for walks in the evening. It's they see their kids now more before than they go to bed because a lot of my partners have small children, like Dr. Maladi. So when they're home by 5:30, they have dinner now with their kids. They go for walks, they go to play, they do whatever they need to activities in the evening. I think that's helped. But I think patients appreciate it also because now in real time, because I will tell you, at least in
Things
our
are
practice,
happening.
huh?
Things are
Things
happening.
absolutely. So to Dr. Bellatti's point, sometimes we'd be a week or 7 days or 10 days or 12 days before we got back to a patient, right? We do the really abnormal ones, we'd call right away. But the normal ones, we try to call, but it'd be kind of lower down on our list of 100 things to do. Now they get called within 24 hours of their lab and they're shocked. And I
And
think
I
that's
think,
very,
sorry, go ahead.
please, no, after you.
I think to Carolyn's point, less clicks on the EMR is more joyful life for a physician. So the
Absolutely.
extra time they're not spending on the EMR, just clicking and clicking and clicking and making notes, it's quality of life.
Absolutely. So my physicians all, I have one doctor, during his lunch break, he's eating lunch and he's sitting there talking to his VMA for 30, they have a set 40 minutes. He closes his office door, he talks to, but he's done with all his labs and all his radiology and all his messages for the day. And they're putting everything in for him. And he's able to look at it because it's all documented in the EMR.
That's fantastic. That means we are taking care of not only the like when we say administrative work, usually people think about the scheduling, the billing, the claims, but we're saying this also helps with some level of triage that actually takes even more tasks off your plates.
Yeah. So I will tell you also, as an independent practice owner, what's important to me is I actually have them verify that morning because they're in a different time zone than me. They verify my patient's insurances, and make sure for us it's important that the PCP is correct. Because if the primary care doctor is not correct, we don't get paid. Dr. Maladi, just the same way for her, she needs to make sure a referral's already in the chart before she sees them. So they do all those things for me, and they send me a beautiful spreadsheet saying these 5 patients have this issue with their insurance today. Please either have the front desk do something or don't see them. So actually, our reimbursement's gone up because of that as
Wow.
well.
Oh, that's amazing. That's a small practice. That's almost like a very quick to implement strategy. If our listeners on the call have not been doing this, it sounds like that's a change every practice should think about.
Absolutely.
And if they're
No
short
leakage.
of,
We're a no leakage practice. Don't leak. It's very hard. People think that, physicians, um, you see a patient and you're done. It's not really a big deal. The honest truth is every patient you see, you're using your expertise
yep,
and it's liability. And we all deserve to be paid for each patient we see. And we have to, the sandbox we play in requires us to do this insurance verification and authorizations and all this stuff. That's fine. But then we have to figure out how to do it so that we don't have any leakage within our practice.
yeah, very true. I'd love to just maybe stay on this administrative piece a little bit more. Besides having people to help, besides the additional tasks we can get the virtual or remote administrative talent to help. How does it affect your overall stress level when you think about making sure the practice stays compliant and whoever is working on the patient's data is using secure software, etc.?
That's very easy, yes. So all of us have to, follow the HIPAA compliance. And as Dr. Saluja mentioned, if you're using a texting service, it has to be HIPAA compliant. All our EHRs are HIPAA compliant. So my virtual assistants and Dr. Saluja's assistants, they all are going through, specific training for that for sure. I didn't handle any of that, kind of like the company handled that.
Yes.
So they do have all the training already when they come to us, and they know kind of like how to use all these HIPAA compliant services within our EHR. And if they are using any, services that are not HIPAA compliant, what information can go into that and what cannot. And we all have, again, HIPAA compliant messaging system between us using kind of like video calls and things that are following all the regulations. And that's very easy and make life very easy to use.
Yeah, that's great. Yeah, that's something that Edge is definitely very proud to be able to provide that kind of training to all the Edge talent before we present them to you guys, to other clients for hiring. I heard that from a lot of other customers as well. I'm also curious, maybe switching gear a little bit about just recognizing burnout in your staff. Besides these virtual assistants or the remote staff that Edge has provided you, how do you also actively monitor, or at least there's a mechanism for your other staff to report to you how they're feeling, and do you have any other programs to manage their stress level? Especially Dr. Saluja, you have a bigger team.
Yeah, so we're very fortunate. I have a behavioral health therapist that's part of our practice. So part of her uh, contract, if you want to call it that, or understanding is once a quarter she meets with each staff member for a few minutes to check in with them. We also provide things like we have outings that we have. We have a summer barbecue coming up in a few months. To have that, we do bowling once in a while. We'll take the staff out. Not everyone joins, but they always have the option. I think the other thing we did is because we heard our staff. So you'll be surprised. Our practice gets approximately 500 incoming calls a day. And before we had remote virtual assistants, my staff would be checking patients in, checking patients out, and answering the phones at the same time. And that was burning them out.
That's
Um,
amazing. Yeah.
we tried hiring people within the office to answer phones. Just that would be their only job. But then the noise volume got very loud in the office because it became so loud, and things of that nature, and they would call out or what have you. So I think removing the phones completely from our office has really improved their professional and personal life, because they're not stretched in so many ways. You imagine you're on the phone, there's a patient in front of you trying to talk to you, and there's a patient trying to check out, and they're trying to do three different things at once, and it becomes very difficult. Now we have a person who just checks in, a person that just checks out, and the phones have now been outsourced, and it's worked out very well. And actually, using our virtual assistants right now, we're at a 90% plus uh, pickup rate. So less than 10% of our calls, so 440, 450 calls go directly, get picked up by a live person. Out of the 40 or 50 that either get dropped where the patient doesn't leave a message, or goes to voicemail, 90% of those are called back with my virtual assistants. So that's improved um, uh, uh, patient uh, satisfaction tremendously in the practice that they're actually getting. Because if you call most big institutions, they'll say, "I never can get through." With our office, that's not an issue anymore.
That's so true.
Yeah.
Yeah. And Dr. Malati, from your standpoint, how do you what's your advice for maybe solo practice owners? How do they like attend to their own burnout level, their stress level? What are some self-care advice you would give?
I think for myself, just honestly making sure things are happening, because when you have staff that, my staff are trained that the insurance update and eligibility needs to happen a week or two before the appointment. You, again, as Dr. Saluja mentioned, in the morning of appointment, you rerun the whole list to make sure everything's in place. Just knowing that those last minute problems are not going to happen, because the worst thing is you start an appointment and you're like, oh, this insurance is not going to work or something, or you see the patient and then you have to chase the patient. And frankly, this was a huge stressor on me, because again, I'm not a physician to have to do this over and over and over again multiple times a day. So having the peace of mind that all of that is happening, all the phone calls are happening. Once I'm done, I personally am still managing my inbox, which now I learned I can do better. But once I'm done with my last patient, frankly, I know I don't have leftover admin stuff. All the messages for the day, we've handled them throughout the day. Everything's done. I can have that little bit of extra time for either I can go for a quick exercise, or I can have a longer time with my family. So that's very valuable to me. I can have maybe 20 minutes of sitting there doing nothing before I go get my kids from daycare. That's frankly my peace of mind and mental health. I think for my staff also, I want to mention, I don't know if I'm doing the best or not, but I think it's important to realize that these are also human beings and they have families, and just noting that we have to treat everyone well, realizing their appreciate work, giving them feedback, what they can do better in a nice way, giving them, the feedback, whether that's positive or negative, in a nice way, not dehumanizing people when we don't see them. I think as a society, we just need to realize that just because we're not face to face necessarily, we're not in person, we can treat each other anyway. And also just honestly checking in with them. I have learned from my mistakes. First time I was taking a vacation, I just put a message out that went out to all my patients on the same day between 9 to 3 p.m. that I'm going to be out for a week, and everyone started calling. And when I saw just the volume of call, I just checked in with my staff being like, are you doing okay? What's happening? Just noticing when they might be stressed and helping them through that, and coming up with strategies that don't be stressed about this. We're going to prioritize this. We're going to do that. And then from myself, I learned from my mistake, okay, next time I'm going on vacation, I'm going to stack these calls so a certain number goes out every other day. So my staff has time to pick up the call and go through the workload. I think, again, you can ask them if I'm doing okay, if there are things that can go better, but I do try to check in with them maybe once a week at least, of any stressors, anything that is happening, on the top of just checking on their inboxes and making sure the workload is okay for them.
Yeah, thank you for the call out. That's so important. Actually, I think this is an area we have seen customers with Edge who have seen success with their Edge talent, just on an ongoing basis, and their business thrive, versus other businesses where we work with. They either don't know how to work with folks who are not there physically, or they have remote staff, but just providing that feedback sometimes can be a little bit of a learning curve. I'm sure Dr. Saluja, you probably have seen that too. You guys grew from the 2 edge talent to 7. Are there some tips in terms of how to give feedback to the remote team members?
Yeah, I don't think I could have said it better than Dr. Maladi. I think show them value and appreciation. They're not there to see your body language, right? They don't see how they've made your life easier and how they've made things work. So you tell them. The only way they are reassured they're doing a good job is by telling them. So my in-office staff knows, you know what, Dr. Saluja saw 25 patients today, for example, and all his patients came and no patients were upset and blah, blah, blah. And they know that the office ran smoothly that day. You know when you had a good office day. My edge staff are not in the office. They don't know. The only way they know is if I tell them. So I actually have a scheduled weekly call with my edge staff. So I had it today from 4:30 to 5:30. I meet with them every week, whether we have anything to talk about or not. We talk about what we did right for the week, what we could have improved upon, where my staff in office could have helped them more, where my staff in office needed more help, and the feedback from the doctors, and to make sure my doctors are giving them what they need when they call about the labs and about the x-rays and about the messages. Are they getting their feedback? And what that does is it gives them a voice, and they feel heard and they feel valued. And I think that is very important. I think at the end of the day, um, everyone tries to do a good job. And I will tell you this, there are physicians who feel um, that they are the practice. That's not true. Medicine is a team sport. And the better your team is around you, the more efficient you are, the less stressed out you are, and the better practice you are for your patient. So you have to value whether they're in your office, whether they're outside your office, value your staff because your staff can make or break you. Good staff is a blessing, and bad staff or disgruntled staff can be your detriment.
Very true. Such great words of wisdom. I'm curious, also, by the way, the when working with your practice to think about patient care, what are some key concerns that tend to worry you besides the administrative, besides the compliance, the billing and the day-to-day? Are there some aspects of working with the patients and the patients themselves that is even a source of stress? The reason why I ask is, as we think about mental health, and I would love to just fully explore the spectrum of
Yeah.
sources of stress, and I
I,
heard
you
that
know,
from other doctors.
yeah, Carolyn, I think that's a great question. So if I understand your question correctly, for me, there's always a patient or two in a week, or maybe three, that you worry about, right? The patient that you're saying, you know what, I think we're on the right track. I'm not really sure. Or a new patient that you're like, I have no idea what's going on with them, right? The puzzlers, the ones that are a mystery to you. And that's what keeps you up at night. And the challenge is, again, because we all have finite amount of time, how closely can we really monitor in an outpatient setting these patients? So, Dr. Maladi might come and say, you know what, I think this patient might have a tumor, a pituitary tumor. I need to get an MRI. The MRI won't be for 4 weeks or 6 weeks because that's how long it takes to get insurance verification. In the hospital, Dr. Maladi would get her answer the same day. So the question is, you know, medicine is unique. Uh, we don't work with computers. We don't work with machines. We don't work with, we work with people's lives. And that responsibility stays with you 24 hours a day, 365 days a year. Even when Dr. Maladi's on her 1 week vacation, the reason she's worried about those calls is because she always is worried about a patient. Something clicks in her mind or reminds her about a patient. And we all do that. That's what a good doctor does. They can't turn their brains off. I think, again, going back to having virtual assistants have a higher degree level, who are more educated than my staff, I now have a list where I say, you know what, I saw Mrs. Smith today. Her sugar in my office was 450. She has her CGM. Can you call her in 3 days and ask her for her readings? And then we can keep adjusting her medications. Or patient had a blood pressure of 180 over 110 in the office. They were out of their medicine. We got them back on their medicine. Can you call them? And they'll come and let me know this is what we did. And then we'll discuss, say, okay, call them back. What do you want to do for them? And then I say, call them back and tell them to adjust this medicine accordingly. So what happens is that 2 month or 3 month or 1 month visit now, I can do more often because I have someone who has a higher level degree, someone who is a clinical person asking the right questions of that patient to make sure they're doing okay. So it takes a little bit of stress off of me when I'm so worried because I don't have the time in the day to call those 10 or 15 patients a week who I'm worried about. Now I have a partner who can help me do that.
Yeah, that's such a great point. And Dr. Maladi, do you have some thoughts to share about how to work with patients?
Sorry, in terms of like with the virtual assistants?
In terms of whether patients, they themselves impose a stress.
Oh, just an imposter. I think I agree. There's like, for me, being a specialist, I think, I don't see the door open and a wide variety of pathologies walk in. So there's usually maybe like one person per week who keeps me up that I'm thinking about, as Dr. Saluja mentioned, like, how can I get this kind of result faster? Frankly, what I do is, which has been really helpful, is if there's something on my mind that needs to get done. For example, on Friday, I saw a patient, she needs an infusion done very soon. And just the thought of, oh my God, how am I going to get this prior auth approved? You're going to do this, but I basically just put a quick message when I'm closing my chart to my virtual assistant of, please call patient's insurance. This is what needs to happen. I need it stat. And I know that, I basically said it can happen on Tuesday. Today, it got done, it got closed, everything's done. I don't have to worry about it because I know it's happening. Once it's done, it comes to me, I get notified, and the patient automatically also, I've trained them, the patient also automatically gets notified it's ready to go. You can get your infusion right away. I don't have to think about what is happening with that if a quick stat MRI or something needs to happen, my staff can help the patient get it right away. And that is very helpful.
Yeah, I thought Dr. Saluja mentioned this quote. It's so amazing. Medicine is not a solo sport. It's actually a team sport. Make sure you are well supported by capable, high quality staff.
Yes, and I think the important part there is that we still should be the people who make the decision, because we as clinical people see what is best for the patient, and for our team. Hopefully we can be compassionate team leaders. But I think it's important for the physicians to be able to make the decision, and then the whole team is there to support the patient to get there.
Agreed. 100% agreed.
Yeah. I want to be mindful. There are questions coming from the audience, and one of them is how do you, whether you experience emotional whiplash, 1 minute you may be saving lives, and the next minute you are explaining a claim is denied. Does that happen often, and how do you handle it?
I'll take that question because I feel like I'm building my skills there. I started out kind of like getting overwhelmed. I'm doing an insurance eligibility check and I'm seeing a patient and now I have a denial. How do I go about that? And frankly, it can be very overwhelming. I've tried to set certain amount of time for that part to deal with because my billing people do everything and then they drop it in buckets for me to work on. I've realized I can't handle that in the middle of everything. It just becomes way too much. And frankly, sometimes paying a little bit more closer attention to that is going to be helpful. I try to do that at least every 2 weeks. Have a certain amount of time to just go through that. Even as little as 5 minutes, I can go through a few denials quickly and just fix that. If a little bit of extra time is needed, it has to be in the middle of the day where, we can just call the insurance or something and I can get help from the virtual assistant. But yeah, just recognizing that time needs to be separate. It can't be in the middle of the patients is very important for my mental health.
Yeah, very true. And Dr. Saluja, do you have advice on this point?
Yeah, I have a lot of respect for Dr. Maladi. I think I was where she is, and I understand her pain. I work with tremendous doctors in my practice, and they made it very clear to me when they joined the practice. They said, you know what, we want to be valued for what we do financially, which is reasonable. We don't want to do any of the admin work. They said that's going to be your job. We want to see patients. We'll provide high quality patients. We'll create healthy patients. We don't want to do the admin work. So, kind of like Dr. Maladi, I actually take a day off. It's called my admin day on Wednesdays. And from morning till night, I have meetings with my biller, with my staff, my virtual assistant, with my office staff, with my manager, with the doctors if they need me, with insurance companies, all these things. So I get all these things done because at the end of the day, again, this is the sandbox we play in. This convoluted relationship between the doctor and the insurance company. It's very complicated and full of nuances. And the smallest little thing, silliest little thing, keeps us from getting paid or reimbursed properly. So what I on Monday, Tuesday, Thursday, Friday, I'm a clinician, and on Wednesdays I change my turban, and I'm not a clinician, and I'm just an admin person, and that's what I do, and that's for me. I can't do the whiplash. I respect people who can. I need to have it separated where I don't allow the two to mix during my day.
Yeah. That's such a good point. We're actually at time, but I really wish that if you don't mind to leave maybe one other word when looking back, what's the advice you might give to the younger self that will have helped you a lot more earlier in your career?
I think for me, kind of when I think about, 2017 when I left fellowship and training and I started out, I'm glad that I was able to work within a group of amazing endocrinologists that I learned how to practice good medicine. But also, I will tell myself that don't stress. And I might have taken the leap of faith earlier in my practice. Because in the end of the day, I think as a physician, we are highly qualified people who can do a lot of things. We went through a lot of training to be able to be physicians, but we feel crippled that we have no sense of business, no sense of how to run a practice. But if we learned all the medicine, it's easy to learn the business side of medicine as well. And I think all physicians can learn that. Now, some people may not want to deal with it, and that's perfectly fine. But it's easy to learn.
Oh, that's amazing. Yeah. Dr. Saluja, what's your advice as well for maybe the younger self looking
Yeah,
back?
I think I think what I wish I would have done earlier on in my career is invest in myself more. So part of it is the mental health, the physical health, but part of it is actually investing in my career more. So now I realize the value of good staff and how much it makes a difference. Well trained, high caliber staff. And I think when I initially started for a number of years, I had one staff in my practice and I was doing everything else. And not only did it take away from clinical time, but it actually, cost you more because you can see fewer patients and you can devote less uninterrupted time to your patients. I mean, there was days when I first started, I was answering my own phones. I was calling patients to follow up for their appointments. I was doing all those things. And I think, if somebody's interested like me, I knew from the beginning I did not have the temperament or the mentality to work for a system. I could have worked for a private group like Dr. Maladi did. I think that that's fantastic to do that. But I just couldn't work for somebody. I want to work with people who can do my job. So I could work for Dr. Maladi tomorrow because at the end of the day, she can do my job and I can do most of her job. So I respect that because we're in the same education level. Um, but if you are going to open up a practice, if you are going to start from scratch, if you don't want to join another group, you want to put your own shingle on the wall and say, this is mine and build something, go for it. Number one, don't waste time. Do it from the get go. But number two, you have to invest in your practice and in yourself and think about what can I do to make myself efficient and make myself a better physician for my patient without sacrificing my personal life and my personal health.
Oh, that's wonderful. Such great words of wisdom. Even in business, my background is business with MBA, but I also personally feel like looking back, investing ourselves is always the best choice.
Absolutely. You never lose with that.
That's so true. Thank you guys both so much for a very insightful discussion today.
Thank
Thank
you.
you.
I learned a lot, and thank you for sharing your tips and tricks.
Absolutely. I learned a lot from Dr. Malati, so thank you, and thank you, Carolyn, as well.
Thank you. I learned from everyone. Thanks.
Thank you guys so much.
Have a
Have a
good night.
great evening.
Bye.
Bye-bye.
Okay, bye-bye.